Let's talk about some basics here. First of all, tell me about the top three challenges to the patient with a substance abuse disorder today.
Well, I like to think about the opioid crisis as a part of substance use disorders. And I think the biggest challenge to patients right now is staying alive in the twin epidemics of the death from opioid overdose and COVID. COVID has changed a lot of things in all of our healthcare systems, and the substance use treatment system being part of that. It has created tremendous challenges, and we've found out just how fragile our healthcare delivery system is and how fragile the system of care is that delivers services to people with an opioid use disorder. So I think that the dual epidemics of death from overdose with opioids and COVID has created a tremendous challenge. And the fact that we are expected to socially distance and a number of providers have left the healthcare delivery system as a result of COVID means trying to get care right now is particularly challenging for people with an opioid use disorder or a substance use disorder.
Is there some kind of a correlation between opioid use and what you're seeing with COVID? Are people who are using opioids more susceptible in some way, or is it just serendipity, for lack of a better term?
Well, we know that all of the indices that we look at to determine how bad substance use disorders are and opioid use disorders specifically have gone up during this epidemic of COVID. So there's more daytime drinking, for example, with alcoholism. There's more drinking at home by young people. There's more depression and drinking for a mental health cause and using drugs. Because the EMRs have the capacity, the emergency medical response teams, the EMTs, have the ability to decide whether they are going to reverse an overdose in the community or take a person to the emergency department when emergency departments are crowded from COVID patients showing up where there are surges. Many of these reversals get done in the community. And as a result, we have sort of the second challenge of people with an opioid use disorder, that they get reversed in an environment where there's not a law or regulation requiring a warm handoff to treatment. So if you were reversed in an emergency department in the past, the emergency department had to find services to refer you to. If your reversal takes place in the community, then those services referrals are not provided. So it delays the onset of treatment for somebody who might have been able to take that teachable moment and convert it into an admission into treatment.
Are you seeing that there was maybe a second wave of that kind of substance abuse as we went through, we have vaccines, things are going to be getting back to normal, and then suddenly there's the Delta variant, and it becomes more of a mental challenge for people, and then they fall back into the substance abuse pattern simply because, we thought things were going to get better, and now they're not?
Well, people who are using drugs voluntarily, have the liberty of using in response to external factors or not. Then if they have volitional control over a decision to use, that's one thing. But when I talk about people who have a substance use disorder or an opioid use disorder, I'm talking about people who don't have the privilege of choosing on a daily basis whether they're going to use or not. They have to get up in the morning, get organized to get the drug, to use the drug, to recover from the use of the drug, to get the drug again. So there are different sectors to be interested in. And if you are responding to the external factor of things not being normal and wondering when things will go back to normal again, and you're using because that doesn't feel good, that feels bad, that's one thing. But I'm actually talking about people who don't have volitional control over their use again. We say that drug use is a preventable behavior, but addiction or a substance use disorder is a fundamental yet treatable disease of the brain. That person who has gone from voluntary drug using to change their mood or mind to someone who has the disorder really doesn't get to modify how they're using in response to what's going on around them. They are on autopilot and they have to use every day to avoid withdrawal.